So when they go to your office, kind of help me understand what the options are when it comes to dental implants of the two categories. One category that you mentioned where they have bleeding gums, bad breath, loose teeth. It's been determined all of their teeth have to be extracted and they don't want dentures. Or the denture wear.
Yeah.
So if they go to your practice, what are their options when it comes to dental implants?
Great question. Great question, Randy. Because I get this question asked all the time. Come to me either with dentures and they can't stand them because they can't wear them, or they're faced with the basically hopeless idea of having to wear dentures. So you really have two main options here. You could either have what's called a snap-in, which it's technically called an over-denture, but everyone understands the snap-in because they snap on and off, where you get a couple of implants in, and you have just a denture, a regular denture, acrylic plastic denture that snaps on and off.
You're not a fan of those, you said.
They're okay. They're better than nothing. The best way that I describe them is it's a really fancy denture adhesive.
Okay.
It's a denture glue that snaps on and off, basically. The denture moves. It's a denture. You can't really bite very well with them. They do move around. They pop in and out. There's a lot more ongoing cost with them, some maintenance costs.
Okay.
Typically about $1,000 a year because you've got to have little parts changed here and there throughout the year because the snap-on part starts to wear out. They're not great. And the reason I don't like them is not that I can't do them. It's that usually patients that have them come to me and say they don't like them. They want something better.
Okay.
They want something that...
Then why do all the new guys that I talk to, and I've had them on the show, they like these snap-ins? Is it because it's easier in your opinion?
It's very easy.
Really? So it's kind of like a starter way to get into implant dentistry?
It's probably the first thing you can do out of dental school. You put a couple of implants in, you make a denture, you snap it on. It's very, very easy.
So beware of that, would you say?
Understand it's an option.
Okay.
It's not the best option. By a long shot, it's not the best option.
So what's the next level up? What you recommend?
The next level up is where you start adding a couple of more implants and you have something that doesn't come out, that's fixed, that screws onto the implants and it stays put. Usually when people think dental implants, they think teeth. You don't take your teeth out at night if you have natural teeth, do you? You don't want to do that with dental implants either. You want it to stay
So how
fixed.
many implants for a full set of teeth on the lower?
Anywhere from 4 to 6, depending on the bone. I personally like to get more in. If I can get 5 or 6 in, I'm going to do it. I'm not going to charge any more for it. I'm just going to try to get more in because I'm in it for the long haul. I want this to be functioning for you for the rest of your life.
Now, what about that upper? Because upper denture has a little bit of suction,
Randy,
so those are okay.
You've obviously never worn a denture.
That's true. That's true.
Be thankful for that. Got a lot of patients that come to me with them. They can't stand it. So the palate, the roof of the mouth part of the denture, you can't taste. You can't taste food the same way. People always say it tastes like plastic. You can't speak very well because you've got, your tongue touches the roof of your mouth in certain words. Yeah. And it moves. It moves a lot. You've got to put goop on it. You've got to put this stuff in there. It can cause a gag reflex. They're terribly uncomfortable. So when you start adding dental implants, the fixed kind, you can take that palate off. You can take that roof of the mouth part of the denture off, and you have this fixed implant bridge.
When you say fixed, it just doesn't come out.
Doesn't come out.
Fixed in place.
Fixed in place. You cannot take it out. I can take it out. If you come see me, we can do certain things to unscrew it, but typically we leave them in. We leave them in forever.
Now, your process for this, and correct me if I'm wrong, that it can be done as little as 3 appointments if everything goes right.
Yeah.
You meet them, determine whether they're a candidate, do the smile design, and then they get their new teeth.
Yes.
Is that an oversimplified way to
No,
explain
actually, probably even 2 appointments.
Really?
So this just happened just a couple of months ago. A gentleman comes to me, and hopeless teeth. His teeth were just all about ready to, you could probably just grab them with your fingers and pull them out. They're all very, very loose. He was terribly embarrassed by it. He wanted it fixed, and he wanted it fixed yesterday. And I looked at him and I said, listen, we do have an opening tomorrow. We had a last-minute opening in our schedule. We could do it tomorrow if you want. And he kind of sat back and thought about it for a minute. He said, seriously, you can fix me tomorrow? We scanned his mouth. We got everything designed and ready for him. The next day, we did his surgery, did his implants, attached his new teeth. Less than 24 hours after I first met him, he was completely done.
Now, you print the teeth in the next room, too.
Right there in the next room, yeah.
It's all done right there.
Yep.
Is that why you do it so quickly?
That's why we can do it so fast. We can design it, we can print it, we can do it all the very same day.
And how old can you be to get dental implants? Like a full arch of teeth supported by implants?
Well, you want to be over 18.
Okay.
And you want to be vertical.
What's the upper what's the upper range?
There isn't one.
Like, what's your oldest patient?
There isn't one. My grandfather, 98 years old.
A full lower set of teeth?
Yeah.
I mean, 98, why would you want to even put him through all that?
Put him through what, Randy?
Okay.
He's asleep. He went to sleep. he woke up with teeth that he can use, he can eat, he can function. He's healthier because he actually has teeth again.
Now, statistically, is there data to suggest if you're in your 90s, they're more likely to fall out, those implants?
No, statistically, as we age, our bone does get softer.
Okay.
It is a little bit, but there are techniques to work around that. Again, you have to go to somebody that knows what they're doing.
So
has
98 is
specialty
not
training.
too old?
No, absolutely
so 70 if they go to your office.
I was
is
6
young.
months shy of the Guinness Book of World Records. Mind you,
Oh, really?
Randy, we were very, very close. I was hoping that he maybe could hold out a few more months so we could get the Guinness record. But yes, this routinely, we do it in patients above 70.
So no more dentures?
No more dentures.
Do you think that's a future of dentistry?
Oh,
Whether it's
yeah.
20 years or whatever, dentures as we know them will be gone. They'll
No
all be
question.
attached to something?
There's no question. George Washington had dentures.
Okay.
Okay, we've come a long way since George Washington in our technology.
What if you have bad gums, though? I mean, if you have gum disease, you have bad gums. Will the implants stick in there?
They will. They will. We fix that at the same time while
What do
we're
you mean?
doing the surgery.
What do you mean?
So sometimes that means we have to remove some of the bad gums. Sometimes we can clean the bad gums
Okay.
while you're asleep. Same thing. And we design our prosthesis, the teeth that we actually put in, we
Yeah.
design them in a way that the gums heal very nicely, that you heal and recover very, very quickly afterwards, and you can keep it clean. So the success to all of these, and there's a lot of guys that are doing these out there, but the success to these is how you design it. The secret really is in the design.
Okay.
If it's designed properly, you can keep it clean. This is going to last the rest of your life.